Well, I always enjoyed science during school and always attended the science fairs. So I got involved in microbiology and infection as part of my undergraduate degree, and looked at infection biology as part of my PhD. But I always had an interest in reading up and following the news on the new up and coming areas of cancer. And so I applied for a postdoc position in Professor Joe Duffy's lab in St Vincent's. And I was lucky enough then to receive the fellowship from the Caroline Foundation to look at our work on vitamin D. So my work is looking at the effects that vitamin D may have on cancer. So this could be used for either treatment or prevention. So there's a number of studies that show that people who have higher levels of vitamin D may not get cancer or are less likely to get cancer. And those who have cancer that have high levels of vitamin D have a better chance of survival. So in my work in the lab in St Vincent's, we can grow up our breast cancer cells, and these are mimicking what we see in the body, but they're also mimicking the different types of breast cancer you can get. And we then treat them with different concentrations or different forms of vitamin D. And at least in the lab environment, we've been able to show that the vitamin D can kill these breast cancer cells or can limit their growth. So moving forward, we are looking at collaborations with a company in Paris who have a very non-toxic form of vitamin D that we're hoping to be able to move forward into animal studies and then hopefully into a clinical trial setting. What these studies have shown over the last few years is that having a higher level of vitamin D is in a benefit for you if you have cancer, and not just breast cancer, in all forms of cancer. So because we live in Ireland, we actually don't get enough sunshine, so the majority of Irish people are actually deficient in vitamin D. So it is very important that we can maintain our vitamin D levels to have the best fighting chance moving forward with cancer. The work we do, hopefully we are going to have vitamin D in conjunction with an already conventional therapy. So we'll be looking at combining these with therapies that patients are already receiving in the hope of improving outcome or seeing a better response in some patients that may not respond to the conventional therapy alone.